My name is Leanne Larange, and I'm speaking to you today from Edmonton. I would like to begin today's presentation by acknowledging that Physiotherapy Alberta's offices are located on Treaty 6 territory, as well as the Métis Nation of Alberta's Region 4, which has been and continues to be the home of many Indigenous peoples since time immemorial. Physiotherapy Alberta recognizes that Indigenous peoples have been helping many live healthy lives on this land since long before settlers arrived. With that, we commit ourselves to helping move people forward in their journey towards a good life, and doing so in a way that follows the spirit and intent of treaty, that of peace, friendship, and understanding. We also recognize that people from across Alberta and beyond are joining us today, and we encourage you to take a few moments to learn more about the lands, peoples, and treaties with which you may be in relationship. We also recognize that many of those joining us today have ties to British Columbia and to the people affected by the disaster there. Our thoughts are with all those who are affected by them. Now, it is my pleasure to welcome Sue Murphy to speak to us today with regards to professionalism. Sue Murphy is the Department Head and Associate Professor of Teaching at the University of British Columbia's Department of Physical Therapy. Sue's teaching interests include professionalism and professional issues, teaching and learning, and topics related to the provision of clinical education. No further ado, I'll turn it over to you, Susan. Welcome.
Great. Thank you very much, Leanne. Much appreciated, and welcome to everybody today. Thank you for taking time to tune into this presentation. So today I'm speaking to a topic that is near and dear to my heart. I love talking about professionalism. I do have quite a few slides, so I'll be going through them quite fast, but you will have the handout to refer to, and I'm hoping also that some of the case studies at the end might engender a little bit of discussion at your work site, wherever you may be. So without more ado, we will get started here. So what does it mean to be a professional in 2021? So today I'm going to talk a little bit about what is professionalism, whether somebody can actually learn to be a professional, and if so, how can we do this? How has the concept of professionalism changed over time? And how do culture and context factor into a person's understanding of what it means to be a professional? So, if you're not quite sure what professionalism is, unfortunately you're not alone. Way back in 2000, this quote from Swick said, "There is really no common understanding of what is meant by the word professionalism." And 14 years later, professionalism remains conceptually unclear. And even as late as 2017, ambiguity in understanding what professionalism means and uncertainty in how best to teach it remains. So it is a bit of a nebulous kind of a topic. I sometimes think of it as kind of nailing Jell-O to the wall a little bit. And while there is no one absolute definition of professionalism, in the literature you will find that there are really three themes. And these themes are called slightly different things, but they basically are fit into the categories of interpersonal or individual, public or societal institutional, and intrapersonal professionalism. So if we look at intrapersonal or individual professionalism, examples of this are really things that we do ourselves as individuals. So it's how we dress, it's how we manage our time, it's our own personal ethics, it's our integrity, our commitment to lifelong learning, our self-awareness, and so on. If we look at interpersonal professionalism, this is really looking at how we relate to others. So this covers the topics such as communication, conflict resolution, the therapeutic relationship with patients, collaboration, teamwork, and so on. And ethics comes into this, of course, as well. And if we go to public or societal institutional professionalism, this is really more looking at things such as compliance with legal or professional standards, your social responsibility and advocacy, so what do we do for our patients, what do we do for the profession, involvement with our professional association or professional bodies, and again, ethics. You'll see that ethics actually threads through all these different pillars of professionalism. So ethics is a strong underpinning of professionalism. So why should we even care about professionalism? Well, it is very integral to regulation. And I really like this quote here. It says, the primary function of professionalism in healthcare is ensuring that health professionals are worthy of patient and public trust. So it has a high linkage with regulation and with patient protection and getting our patients really to be able to trust in us and know what they are getting when they come to physical therapists for service. I thought this was a really interesting perspective. This is by Anthony and Jones in 2016, and it says, we continue to make allowances for clinicians who breach professionalism as long as they are clinically expert. This is symptomatic of a culture that values measurable clinical expertise above that of professional competence. The perception that some professional skills are somehow optional in clinical practice is particularly concerning. And if you think about that for a moment, I think that has very much been true in previous years. I'm hoping that things are really changing on this front now, because I think even in the last 5 years, there has been a huge emphasis on professionalism and in really thinking of what being a professional means. But if you think back to the stereotypical surgeon in an operating room throwing scalpels about and yelling at the nurses, a lot of people say, oh yes, but he's a good surgeon. And they're really looking at the clinical skills rather than the professional behavior. So I think it's an interesting perspective and one that's worth bearing in mind here. And it's perhaps a prod to us to really think about the fact that professionalism needs to be as core to practice as some of the hard clinical skills that we perhaps sometimes focus on. So is professionalism an issue for physiotherapy practice in Canada? And unfortunately, yes, it is. And anecdotally, this is pretty anecdotal, but it is borne up by some surveys that have been done. These are some of the things that the regulators see as issues with professionalism. So we think about things such as boundaries, communication, fraud or billing violations, conflict of interest issues, documentation and charting, that's a big one. Malpractice or lack of competence, privacy, confidentiality issues, consent issues, marketing, support personnel. There's all sorts of issues that regulators will see in the clinical setting. So if we think of professionalism as a competence, so what is a competence? And a competence is the ability to handle a complex professional task by integrating cognitive, psychomotor, and affective skills. So again, it's very much kind of a catch-all. If we think of professionalism being a catch-all, it has all these elements in it, the cognitive elements, the psychomotor elements, and the affective elements. And the way I'm going to present elements of professionalism today, I think very much build into this description of a competence. So what we really want to do is to develop people to be competent in professionalism. Some of you are probably very familiar with Miller's Pyramid, and what Miller's Pyramid really does is it shows the development of competence from novice to expert. So a novice may know something, may know a clinical fact, or they may know, for example, the college standards. Then the next level of competence is knowing how. So how do you actually apply these? What does the knowledge actually mean in practice? Shows how means that you can actually demonstrate that in practice, and does means that you do it automatically. It's built into you. So I would posit that professionalism can also go through the same pyramid of development of competence. We can know about professionalism, we can know how to be professional, we can show how, and we can do. But do we always do it? So the way I'm going to frame this today is that there are four key aspects of professionalism competence, and these are professional knowledge, behavior, values, and identity. So knowledge is probably the most simple or the most basic tier, if you like, of professional competence. So professional knowledge is things that come through training, through standards, and again through context. So professional knowledge is things such as knowing clinical practice guidelines, knowing standards of practice, knowing the law, knowing what you can and cannot do as a professional, all that sort of book learning, if you like. And it is mediated to some degree by context. because you may be very professionally competent in one area but not in another. So, for example, I would probably be quite comfortable, if you think of it in clinical terms, I would probably be quite comfortable in an intensive care unit, but I would be extremely uncomfortable in a pediatric neurodevelopmental setting, just because that is not my skill set. And the same thing happens with professional knowledge as well. You may be quite professional in one situation, but be a little bit out of your depth in another. If we move on to behavior, what is professional behavior? Does it differ from knowledge? Yes, it does, because it's what the practitioner actually does. So, for example, in my role as an educator, students may be able to answer questions and show how in a multiple choice exam, but do they go out on clinical practice and do they do it? Not always. So the behavior and the knowledge are two different things. So, for example, a practitioner may be able to correctly explain or demonstrate testing skin sensation. Do we all do it every time in the clinical setting? Not convinced about that one. So, defining expectations as observable behaviors is actually very useful because it can facilitate discussion, assessment, and modeling of professionalism in medical education and clinical care. So that's important for us because we have to know what behaviors we expect people to show and what we expect to see in the clinical setting. Now, professional behavior can be influenced by a whole myriad of different things. So this is unlike knowledge. Knowledge, you either know it or you don't. But behavior can be influenced by different things. And these are some of the factors that might influence your professional behavior. We'll talk a little bit more about some of these, just briefly, but things such as the hidden curriculum, role modeling, beliefs, values, generational beliefs and values, and again, context plays a piece here. Context really weaves throughout all these elements. So I'm sure most of you are familiar with hidden curriculum, but for those of you that aren't, hidden curriculum really refers to that learning that takes place that's not part of the formal curriculum. So it comes through informal interactions, it comes from the context, it comes from the organization structure, and cultural influences as well. Some of the systemic issues that we talk about quite a bit today. So all of that is the hidden curriculum. So just to give people an example of this, and I think this might be familiar to some of you, so we have a new graduate physiotherapist. They go to work in a private practice. However, when they get there, the charting standards are minimal and really don't follow the college standards. So after a few comments such as, wow, you sure pay a lot of attention to charting, and oh, I can tell you're a new grad because of all the charting you do, the new grad therapist feels pressure, really, to lower their standards in order to fit in, and because it's obviously not important. And these pressures then can be compounded, for example, by a clinic owner who just says, oh, spend less time on that charting stuff, see more patients, you're being too slow with all your documentation. And that really gives the PT the message that seeing more patients isn't more important than following college standards. And so these real-world pressures and messages, this hidden curriculum of, oh, you don't really need to do all that, is far more likely to be perceived as important than what we say during the educational training or through missives in the college newsletter. And role modeling is really an important part of the hidden curriculum. It has conscious and subconscious elements. Sometimes you may be aware of what your role model is doing, and it's like, wow, I really want to be like them, or not be like them, as the case may be. And other times it's a little bit more insidious. And it can just be something that you kind of pick up. It's a bit like sometimes you hear in families people using the same expressions or doing the same behaviors, and it's just something that's picked up and becomes ingrained into you. So role modeling, it can actually be very important in developing professional behaviors, professional identity, and also shaping people's career aspirations. And we see this a lot with students that, they'll go to a placement site and they'll say, oh, I really want to work there. The therapists were just amazing. They were just great. They were all enthusiastic and motivated and keen and so on, or vice versa. So to be a good role model, people really need to have not only good technical knowledge, the high standards of clinical competence, but they also need to be good teachers and have those humanistic qualities as well. So again, just an example of role modeling, so of course, during our programs, we all talk about maintaining confidentiality. Students go out on placement and they hear their supervisor discussing a patient with the OT in an elevator. And the student, even though they have had it drummed into them that confidentiality is important and you don't discuss patients in public places, etc., they're much more likely to follow the OT, the example of their supervisor with the OT. And that's due to a few factors. It's due to the power differential and, the need to pass the placement or not wanting to challenge your supervisor, that need to conform and fit in, and also the assumption that, well, this is the real world, that it seems to be fine here, so I guess that's what I should be doing, not necessarily what I've been taught in the educational setting. So the next piece that we need to talk about, I think, is that professionalism is contextual. And in these four snapshots here, what I'm really trying to say is that if you think about these, it's actually in every situation in those settings, I think we would say that people were being professional. In the top left corner, we've got a young patient being encouraged to play with the stethoscope to make them feel comfortable. Very professional. In the next one over, we have a therapy dog at the edge of the plinth there, if you can see them. Again, very appropriate. On the bottom left, we have somebody in army fatigues doing the treatment. This is obviously an army rehab center. Very appropriate. And in the last one, we have somebody holding the hand of a patient who's obviously distressed. Very appropriate. But if you change the context slightly, you're not going to want an adult patient to be playing with your stethoscope. You may not want dogs in your private practice. If you show up to work in army fatigues, people may give you a bit of a questioning look. And during COVID or during some specific clinical situations, you're not going to be sitting there holding hands with your patient. So professionalism is a very contextual concept. And that makes it really very hard to teach, hard to learn, and also hard to assess and to evaluate or regulate because it's different in every single clinical encounter. And it shifts, it's complex, it changes over time, etc. One aspect of context that I think we really need to think about at the moment is generational differences. And the quote on this slide actually talks about medical practice and physicians, but I think it does apply across probably all the health professions. Established physicians need to stop defining perfection as being just like ourselves and realize that encouraging professional excellence in ways that are culturally and generationally diverse are the only hope for the future of the profession. And I put the picture there of the two cars just to sort of illustrate that those are both Mercedes, but they are different generations. They look very different, but they are both the same type of car. So if we look at generational differences, I found this quote a little depressing, but it's also quite humorous, I think. So different generations, and I'm not trying to stereotype here because obviously there are vast differences in different generations and different cultures. So I'm not really stereotyping, but there are certain characteristics of different generations which are identified in the literature. So, for example, millennials have been characterized as entitled, indulged, and sheltered. They see their healthcare role as a job and not their identity, whereas baby boomers are competitive workaholics, and Gen Xers are cynical, skeptical, and pessimistic. I hope there were some positive things too, but it does just show you that people are different from different generations or tend to have those characteristics. And as we get more and more millennial generation or Generation Y into the workplace, I think we really need to think about how millennials may see professionalism and what to them professionalism means, because it's not necessarily the same conceptualization as it has been in previous generations. So again, the millennial generation typically are technologically very savvy, and they also value free time and life balance. And again, this is actually from medicine, but I think it's really interesting to see there what residents look for in their first job. And you'll see that salary is down the bottom, and work-life balance and mentoring are much higher up the scale. And this is perhaps different to previous generations. And this is, I just put this in for a little bit of levity, but millennials also communicate differently. This is an actual email a professor at a UK university received explaining why he wasn't at a lecture. And I know it's a bit British, so it needs a little translation there, but hiya, I'm sorry I'm not there. I was in bed with my boyfriend, which I guess is boyfriend. He got some hand cream in his eye, took him to hospital, the car broke down. We had to wait for the green flag man. That's the road safety people. Got chatting with him before we went to A&E, i.e. emergency. We're here now and the boyfriend is fine. I mean, personally, I cannot imagine sending that type of email to a professor at a university, and I know I'm definitely of the older generation, but I think it's a very different, it really illustrates how people sort of see these communication as a very different way of doing things. And again, on social media, I found this quite shocking that there was a study that looked at resident and medical student profiles, and 70% had photographs containing alcohol, but worse was that 30% had inebriation, explicit sexuality, foul language, and privacy violations, which this was back in 2013, and I'm not sure it's really got any better, probably. So I think social media is certainly a little bit of, it provides a big challenge for some aspects of professionalism. So this is just to show some aspects of the millennial learner, and again, we're not trying to stereotype here, but we're just trying to show some of the facets of or some of the typical traits, rather, of a millennial learner. And if you look at them, some of them really, they don't necessarily fit with our conceptualization of professionalism. So, for example, keeping in touch with friends and family at work via text, phone, or email, you know, a few years ago, that would have been considered quite unprofessional. Being skeptical of hierarchy. You know, some of our healthcare settings are pretty hierarchical, so that doesn't necessarily fit terribly well. And, of course, these traits may well influence the millennial perspective on professionalism. And culture, of course, is another consideration. Typically, those from different cultures will have very different conceptualizations of professionalism. And interestingly, from some of the internationally educated physical therapists who come and take some of the bridging programs in Canada before working in Canada, these are just a selection of quotes from some of those people. And it's really interesting. When the doctor comes into the room, I am to leave. What do you mean I can't go to dinner with my patient? It's my custom to greet people with a kiss. And I think you'll, you know, when I look at those, I think, wow, if we saw somebody doing those, we'd think, gosh, they're unprofessional. And yet in a different culture, in a different context, that's extremely important. This is what being professional means. So then we should move on to professional values. So professional values are at the center of professionalism and are the determinants of professional behavior. And values are important because they are really the basis for professional identity and that fourth element of professionalism. So as most of you probably know, CPA does have core professional values that have been developed for the profession. And this is really just a statement of the profession's professional values. And interestingly, the core values, the CPA core values, do actually have behaviors attached to them. So we talked a little bit about professional behaviors. So the behaviors are based on the values. So, for example, the accountability one from CPA, they give an example of this is how a CPA member demonstrates accountability, engaging in reflective practice, acknowledging errors, assuming ownership, evidence-informed practice, and so on. So there are certain behaviors which demonstrate the value that is underlying them. Professional values are particularly important because they are a strong predictor of predictable professional behavior. So, for example, if a physical therapist really has the value, a strong core personal value and a professional value, that lifelong learning is important, they're much more likely to keep clinically relevant than somebody just saying, you've got to take a course every year to renew your registration, or you have to do one course a year as part of your employment, or so on. That's not going to lead necessarily to being clinically current, but a core value of lifelong learning may. So values and behaviors are not the same. We all know situations where our values are compromised in the clinical setting. So, for example, a PT we might value spending a lot of time with a patient, but due to the amount of the caseload, system constraints, and so on, we may have very limited time to spend with a patient, and we may have to focus our treatment on things that are actually not what we really value and feel is important in that clinical scenario. And this can be actually quite distressing for people and can lead to a lot of stressful interactions and burnout. So sometimes professional violations hit the headlines, and often these are behavioral things. If you think of sometimes the sexual misconduct, things which are conflict of interest, inappropriate marketing, those kinds of things that hit the headlines, but they often originate in values and attitudes which lead to those behaviors. So there's something underlying the behavior itself. The issue is that values can be really difficult to identify and difficult to assess. This is particularly important, I think, in either the regulatory world or the educational world. It's very hard for clinical supervisors, preceptors, instructors, and so on to give feedback to students based on values, because it can be seen as being threatening and implying some sort of character defect. It's much easier to say to somebody, okay, you need to review the anatomy of the shoulder, rather than to say to somebody, I don't think you respect your patients, you don't seem to respect your patients. That's a much harder message to give, and is also often received much more personally, leading to a lot more debate and conflict. So if we move on to a professional identity, which, as I say, is very much based on your values, professional identity, the term itself, can actually mean two things. It can mean what are the identifying features of a profession, so sort of who are we as a profession, but it can also mean who are we personally as professionals, and it's that second definition that I'm really talking about in this presentation. So professional identity is really the being part versus the doing. It's who you are as a professional. And I think if we think about it a little bit, it's that personal transformation of self which takes place during early years of training and practice, but I think actually continues throughout one's professional lifespan and life sphere. So if we go back to Miller's pyramid, there was some interesting work done in 2016 by Cruz and Cruz, who actually added professional identity as another layer on top of the pyramid, and I think it's very timely that they actually did this. So in the bottom layer, you've sort of got knows the behavioral norms as the knows. In the knows how, you've got knowing when individual behaviors are appropriate. In the shows how, you've got demonstration of the behaviors, perhaps under supervision or under an interim license, for example. You've got the does bit, which is just they just do this as part of normal, regular practice. And then on top of this, you've got this professional identity piece. And this professional identity piece really consistently develops the attitudes, values, and behaviors expected of one who has come to think, act, and feel like a physician. So I think if we think back on our own careers, whether there was a defining moment where we suddenly thought, acted, and felt like a physiotherapist. I don't know. But I think, again, if we look back over our professional lives, there are times where we've identified us as slightly differently in that clinical setting and have perhaps developed that professional identity. And of course, the identity can be very different in different clinical settings too, because the role is different, the setting is different, the context is different, etc. So how identity is formed is actually very complicated. It changes across time. It changes with who you're with in the community of practice. It changes on who you are as a person, as your beliefs and values and motives change. That can change your professional identity as well. So it's not an easy thing to develop or to predict how it will develop. Some of the things that do support professional identity development are professional socialization, so being with members of the profession, with good role models, and so on. Reflective practice is important, communities of practice, and this legitimate peripheral participation schema, which basically means that when you start into a new community of practice, for example, typically you'll have a fairly peripheral role at first, and then you're kind of invited into the group or into the scheme. So you take on more roles. For example, you may take on more committee work, you may take on more projects, you may take on more complex patients or a bigger caseload, etc. So it's that kind of moving people towards the center of their practice and center of who they are. All of these things will help to develop professional identity. So I think with this, we will move on to some of the case studies. It's a little difficult to do, obviously, discussion of case studies on the webinar, but we're going to do a couple of polls, and I'm going to give you hopefully some ideas of things for future to think about either after the presentation or to discuss at a later time. So this is our first case study. So I will just read it. So a physical therapist was observed taking part in a white supremacist rally on a weekend, and a video of the rally with the PT clearly visible was posted publicly on YouTube following the event. The PT's employer and the regulatory college have been besieged with irate calls from members of the profession and from the public condemning the behavior. So the questions I'm going to ask are, is professionalism an issue here? And I'll give you a couple of minutes to think about this. And if so, what aspects of professionalism might be involved? So is it knowledge, behavior, values, and or identity? And of course, it could be one or more of those. It doesn't have to just be one, because they are very intertwined. So just give that some thought. And then the third question that we won't really talk about too much today, because I'll leave this for some individual thought, is what action, if any, would you recommend by the regulator and or the employer? So we'll just move on to a poll for the first two questions if you've had time to think about it. So whenever you're ready, just pop your answers into the poll there. Okay, I'll give you just another couple of seconds there. Okay, I can see some answers coming through, so I'll just give you a couple more minutes or a couple of seconds. Okay. So yeah, interesting, very interesting results here. So about 2/3 of people say yes, it is, professionalism is an issue. About 20% say no, and I agree. The unsure is, I'm kind of siding with the unsure ones here because it's really a tricky issue. So I'll talk a little bit more about that in a minute, but I think we'll go on to our second poll. So if you think it is a professionalism issue, for the 2/3 of you that think that this is an issue, what aspects of professionalism might be involved? So is it knowledge? Is it behavior? Is it values? Or is it identity? Or is it a mix of all of them? So again, I'll give you a couple of minutes just to think through that and to pop them in. And you can put in more than one, you can put knowledge and behavior, knowledge and values, etc. If you feel so. More than one answer is fine. Okay. So we'll move on to this one. So interesting. So we've got a sort of 60% for behavior, 70% for values, 40% for sort of almost 40% for identity. Really interesting. And yes, I would agree with. I would certainly agree that that knowledge is not an issue here, because the sort of key parts of this case are really that this person is doing this on a weekend. So we're assuming that this is not, they haven't run out from the hospital to do this in their uniform or whatever. They are on their own time doing this. So that is an aspect we need to consider. And that actually raises quite a few, the really interesting question of, if you are a professional, are you a professional 24/7? Or are you only a professional when you step into your workplace, or when you're with a patient, or at some other time frame? Does it matter? And I think it's a really interesting question, and it is one that's being debated quite a bit in the literature at the moment, because should somebody be a professional 24/7? It kind of goes back to that example of the slide when they had the medical student images on social media, and there were these photographs on social media of them being inebriated or sexually explicit. Well, maybe they were at a party in the evening. Maybe they were on a weekend. Maybe they were doing whatever. So is that actually unprofessional? I think most of us would probably say yes, but it does raise the question of once a professional, always a professional, or maybe not. So I would agree that behavior, values, and identity can all be part of this, absolutely. The thing that's a little difficult here is that we assume that the person in the rally is there because they want to be there, that they haven't been coerced into that. You never know, but we'll assume that they haven't been forced into participating in this rally. We assume, therefore, that their values do relate to white supremacy, which may collide with their professional values, if we're talking about equity and in health and those types of things, and anti-racism issues and those kinds of things. So that certainly needs to be a part in there. The identity piece is interesting, because are they identifying in this as a white supremacist, or are they identifying as a physical therapist? I hope they're identifying not as a physical therapist in this particular piece. But it's an interesting case, and it is based on reality. All the 3 case studies that I have are actually based on reality. So If we move on to what action would you recommend by the regulator and the employer, I'll leave you to think about that one because the format of the webinar doesn't allow for some really good discussion. But I think it's a tricky one because of the fact that they are on their off time. They're not representing the profession, but people have recognized them as a profession, as a physiotherapist. So that is somewhat complex for sure. And again, if you were the employer, would you really want to be talking to this person about their values of white supremacy and what that means? You might not. And either way, do you want a white supremacist in your clinic? Maybe you do, maybe you don't. But it does raise some very interesting questions as to how one would remediate that particular issue. So we'll move on to case study number 2, and I'll let you read this one. But the gist of this is that, and this again is a real life story. So there is a student out on placement with their preceptor. The student is doing quite well on the placement and has been talking to a patient who is interested in nutritional supplements. So the student says, "Oh yeah, my partner's actually a naturopath. I can get you a really good deal on that." And the patient is delighted. Student goes away happy because they're making a sale for their partner. Patient is happy because they're getting a cheap deal on their nutritional supplements. Patient is so happy that they say to the preceptor, "Oh, can you actually give this student a really high grade? I think they're awesome." Preceptor finds out what happens, feels very uncomfortable with it, but doesn't do anything about it. So again, same questions here. Is professionalism an issue? And if it is an issue, we'll ask you about the knowledge, behavior, values, and identity. So when you're ready, pop your answers into the poll as soon as it comes up. Okay, just a couple more seconds for this. Interesting. Okay. By student and supervisor. I would totally agree. I think it's the student and the supervisor. Because the student is obviously having some issues with their role and what is appropriate and what is not appropriate. Conflict of interest is coming up loud and clear here. But also I think the supervisor has a role in this too, particularly as we're talking about a student potential breach of professionalism. The supervisor has a role here to play in educating and remediating and so on. So if we look at the next question, again, so we've decided that professionalism really is an issue here. So what is it? Is it knowledge, behaviors, values, or identity? And just pop your answers into that one. Okay, just a couple more seconds. Okay. Interesting split here. So we have knowledge, we have behaviors, we have values, and identity. And I would agree, I think all of them are an issue here. I'm really interested to see that behavior is one of the biggest ones here, and I agree, because the behavior is inappropriate. Because they are a student, we really don't know what their knowledge level is. You would hope, and I would hope, that any student we send out on placement would know that this is an inappropriate thing to do, that this is a conflict of interest, etc. But knowledge could be an issue for a student, so I think that's very legit to put in for this one. Behavior, definitely. You don't go around soliciting your patients for what can I sell you at a cheap price. Values is really interesting, because I think what comes into play here is this, and it kind of is wrapped up with identity too, is the student being the partner of somebody who's a naturopath and is valuing getting them a good deal and making money for them and supporting their practice and so on, or are they really identifying as a physical therapist who's a professional and therefore does not have these types of relationships? So I think the values and the identity are really quite mixed up here together, as they often are, I think. But yeah, interesting scenario. And again, what would you do in this situation? I'll actually tell you that this was a situation that we had, and so we had to talk to the supervisor about what would have been appropriate action to take in future, which would obviously have been to talk to the student about how this was inappropriate, professionally inappropriate, etc., and why. We had to talk to the student about the same issues, why it was professionally inappropriate and why. But then we had an interesting situation, because the supervisor felt they should pass their placement, and we felt that they shouldn't, based on this breach of professionalism. So there was some negotiation there. And from what I remember, the student, we decided they did pass it, but we gave them what we call a weak pass. So they would have had some remediation to do in addition to actually passing the placement on this. And so, that one doesn't seem to want to show. Leanne, we can't seem to show case 3 here. It just says problem displaying the slide. Can other people see it?
Sue, I think it should show it.
Is it showing okay?
It is showing for me on my audience view. Yeah, it is showing.
Oh, okay, good. Mine has gone completely blank, and I actually can't see. Oh, yes, there we go. Okay, let me just...
Do you want me to read the case study for you?
No, it's fine. I'm just... I haven't got the live view for some reason. Disappeared on my end, but that's okay. I can do it this way. What slide number are we on, Leanne? Do you know? 59, isn't it?
Showing as 59, yeah. But okay. That includes your poll question.
Yeah, okay.
About 51.
All good. So yes, for our third case study, hopefully this doesn't happen too often, but essentially a patient has called the college to complain that they were charged $80 for a treatment in a private clinic that consisted of a hot pack and advice to take up pole dancing to increase their flexibility and strength. So what do we think? Is this just a complaining patient, or is there a professionalism issue here? So again, we'll move on to the poll. Is professionalism an issue here? We'll just give you a couple more seconds there. Okay. Yes, no, and unsure. I agree. I'm kind of leaning towards the unsure ones myself. I would agree that if all the facts of this are true, I would go with yes, definitely. But I think that the problem with this one is we don't really, all we've got is the patient's perception. So we don't really know if this is actually true. And we assume that it is true. Obviously, we don't think that people come with fictitious claims, but I know that sometimes that is the case. Was there a misunderstanding? Was there a communication issue? It's kind of a tricky one here, I would say. So I think we don't know. But let's, for the purposes of this, let's assume that the complaint is completely legitimate and that the facts as given are true. So given that, let's move on and say, okay, so in that case, is it knowledge, behavior, values, or identity? So we'll move on to that one. Okay, just a couple more seconds on that one. Okay. Oh, and a fairly equal split here between knowledge, behaviors, and values, with a little bit more about identity. And I would agree. I think we have a knowledge issue here, because if the treatment that is being described is as if the treatment given is as described, then I definitely think there's some knowledge issues here. Is that really what the patient should be doing to enhance their condition? Of course, we don't know what the condition is, but that seems an unlikely remedy for their complaints. Behavior, I would love to have some discussion with people as to the behavior here. To me, it seems a very quick and easy treatment. Oh yeah, here's your hot pack. Here's some advice. Go take up pole dancing. It'll be great for you. That doesn't seem to me like a very fulsome and professional treatment. Values, I do think the values comes into play because pole dancing is really not something that I would necessarily recommend to a patient, just because of some of the connotations of the pole dancing. So yes, people may think it's okay, but other people may not think it's okay. So I think there is a value judgment in there that perhaps was not optimal in this situation. And identity, absolutely. Like, as a professional, is this really professional advice that you would be giving? Is this really what a fulsome professional treatment would look like? How about the commitment to your patient and to their needs? Is this something that they would like to do, et cetera, et cetera? So I think the split as we see here is actually very representative of how I would feel about this scenario. Great. So again, I will leave you to think about the actions that should be taken after the presentation. So just to finish off with, really here, we will talk about some current trends in the literature. And again, Leanne, I'm sorry, my browser has disappeared here. So I'm hoping that we're on the slide that says current trends in the literature. Is that correct?
I think you want to go back one here. I'll take you back.
Want to go back one? Okay, perfect.
Yeah.
All right. So, so current trends in the literature. If we're looking at professionalism, certainly areas such as cultural context and professionalism in different cultures and contexts is something that's developing a lot of traction right now, and people are really interested in really different formulations of professionalisms in different contexts. And this really does also play into the next issue, which is the client's perspective. So the client, we talk a lot about professionalism from our perspective as regulators, as therapists, etc., but do we really take the client's perspective into consideration? And of course, team-based care and interprofessional issues may also really affect how professionalism looks. So there's a lot of literature about teaching and learning professionalism. unfortunately, not a lot of it is actually very conclusive. There are really no guidelines as to how to best teach professionalism, which makes life very difficult for us, but it does make it quite an interesting topic to look at. There are different methods that we can use, and I think really my key message is that if we break it down into the knowledge, behaviors, values, and identities, it at least guides us a little bit into what teaching or remedial efforts we can use to kind of focus on those elements and perhaps put together a better curriculum or a better way of addressing professionalism. So my key messages today really are that professionalism is hard to define and even harder to teach and learn. It's an ambiguous concept. There's obviously the 4 elements. And again, just to reiterate that role modeling and the hidden curriculum do play a very large part in shaping identity. And I know we're just about at time here, so I'm not sure how much time we have for questions, but we are at the end.
You can see how fast folks can type their questions in, and while we're giving them a moment to type in any questions they may have from the session, I thought I'd ask you, that came up for me as you were talking about providing feedback and talking about that scenario with the students, Sue. So yeah. I was just wondering, in your presentation you mentioned that giving feedback around professional values can really be very difficult to do, and the character attack in some cases. I guess I'm putting words in your mouth. I acknowledge that.
Yeah.
Have you got any suggestions for how to do that and do it well, whether you're giving that feedback?
Yeah, that's a really good question, Leanne. It's a really good question. I think the way I would do it is I would tend to go with starting off with the professional values, and going, for example, if you go back to the CPA values, you can have a discussion in a much less personal way about the fact that these values, as described by CPA, are what we expect in the profession. These are our professional values, and as individual practitioners, we really have to live up to these values, and we have to embrace these values. And then you could ask the student to reflect on, in this situation, which of these values is not being supported or is not being demonstrated, and really try and tie the individual values to those CPA values, which are, they're much more neutral rather than just saying, well, obviously we're out to make a quick buck, or something like that. I mean, I'm being a bit facetious there, but you get the gist. So I think trying to separate it from the person and from the individual, even though you're talking about their individual values, trying to make that separation is actually a good starting point. And hopefully that will lead to some reflective and introspection by the student, where you can get more into the individual behaviors and differences.
I have a question from Susan, who asks, is there any data to suggest that professionalism is remedial, or do tend to reoffend even after?
Yeah, that's a really good question. There are a few studies on that. There is evidence to show that if you see professionalism issues either in medical school or during health professional training or those aspects, those issues will tend to recur in real practice. So often when there are complaints to the college or issues to the college, sometimes it is somebody who's had a rather rocky journey through the academic setting as well. So there certainly is a link there. As for actual remediation and whether it works, I think the data's a little bit rocky on that. Certainly there are some things that you can try for remediation, things such as feedback, reflective exercises, tackling issues right at the time rather than letting them escalate. There are some key principles, and there are also certain times where it's good to where somebody may be particularly receptive to feedback on professionalism. So there are some ways of doing it which there is evidence to show that it is better. But how long-lasting it is, I think that's a really good question, because if somebody's personal values are very different or are against what you're trying to educate from the professionalism perspective, I suspect that the longevity may be questioned. Yeah, it's a good question.
I have just one more for you, and it's sort of trying to delineate the difference between professionalism issues and just bad practice. So some people reading that scenario number 3, would say, well, that's bad clinical practice.
Yeah.
You need to know if it's one or the other, or is one always the other?
Yeah, I think that's a really interesting discussion point too, because I think depending who you are as a professional, it goes back a little bit to that question of whether you have lifelong learning as a value. If that's one of your personal and professional values, that I'm going to be a lifelong learner and I'm going to be clinically competent, then I would say that in that last scenario, the person probably was not, and so therefore it would be a breach of professionalism. So I would tend to say that malpractice or lack of competence and those types of things, I would say that is a breach of professionalism, because I think certainly in the CPA values you would find clinical competence in there in one of the values, or if not more. And I think it would be really hard to be a professional who is not clinically competent. So I think that way definitely works. I definitely think, though, that you can be clinically competent without being professional. And again, to go back to the example of the surgeon throwing the tools around the operating room, he may be very clinically competent, but he's not being professional. So I think it works one way, but not necessarily the other.
I have one. This is sort of building on the same kind of clinical competence or clinical practice kind of question, but linking back to professionalism. So the scenario that presented is a patient you're treating needs exercises because of instability or weakness, but they want to be treated passively. So how would you handle that as a professional?
Right. So you want them to have active treatment, but they are really wanting more passive treatment. That's the gist of this one, right? Yeah, and certainly I think that very much goes down to communication and education. And it's very interesting that a lot of the professionalism breaches that people see and that come to the college, and certainly that we see in the educational setting too, I would say a huge percentage of them comes down to communication. So in that situation, I think it's really important to communicate why your approach is more appropriate, and why they may do better with your approach. So, that's the obvious answer. But I think the more interesting answer is that if you get to the point where they are saying, this is what I want, and you're not going to give it to me, and you really don't feel that you should be giving that particular treatment to that particular client, then that is, I think, where the real interest of professionalism comes in. Because so you can ask yourself, I think you could go several ways with this. You could say, well, is there likely to be some sort of placebo effect if I do this, so that the patient will actually go away feeling better, and maybe that's the therapeutic benefit, and maybe that's okay. Or maybe you say, I absolutely cannot, in all good conscience, give this treatment to this client because I don't feel it's evidence-based and it's not going to work, in which case you're probably going to refer them to somebody else and say, this is not who I am, this is not who I identify as a professional, somebody who will do that. I think there's a variety of ways you can go, but I would definitely start with communication. And of course, for all these professionalism, whether we're talking knowledge, values, identity, behaviors, communication is key to all of those. To be able to explain who you are as a professional, what your professional identity is, all of those things, developing the therapeutic relationship. So communication's key, but yeah, the outcome of that, I think, will depend on who you identify with yourself as a professional.
That answer, it's an interesting thing to think about. I think you highlighted that there's no clear answers to some of these questions.
No, there isn't, and yeah, that's exactly right, and that's why professionalism is so difficult. thinking back to the slide where the 4 clinical scenarios was, should I have a dog in my private practice? Well, again, it depends, right? It depends on the context. It depends whether it's a therapy dog. It depends whether it's, maybe you're in an area where that's done and would be helpful to somebody. So yeah, there are no clear answers. But I think by having the 4 concepts and thinking about, okay, what type of an issue is this? And most importantly, of course, who am I as a professional, and does this work for my values and the professional values? That gives you a bit of a starting point, but it's not easy. It's not easy at all.
I have no other questions in the queue just now, Sue. So I think we'll, recognizing that we're a little bit over time and probably many folks have had to leave to return to their patients, I'd like to thank those who are still with us, and I'd like to thank you as well, Sue, for being part of the presentation. An excellent session with lots to think about. We'll say goodbye for today and hope to see everyone at our next webinar coming up